Everyone, we will go ahead and get started so that we can make sure we end on time. For those of you that don't know me, my name is Jake Reese. I am the Associate Program Manager for MCT2D. I'll be leading today's Touchpoint call. For anybody that is here that is on both MCT2D and Inhale, participating in both of those CQIs, and Inhale, as usual, will go after us. And between those two, we do have Mark Cohen here from Blue Cross Blue Shield, who will be giving a brief presentation about some VBR information, and he'll go right in between the two CQIs presentations today. So I'll go ahead and get started here. So the first thing is just our agenda. So we'll go through and give a brief update regarding our collaborative-wide meeting, a tentative agenda for that, which is coming up in the end of June, or middle of June. We'll talk a little bit more about annual PO calls and how we're going to be pivoting some of the requirements with regards to that. The best practices searchable database, some upcoming meetings that we're going to be hosting, a recap of the regional meeting, and then some of the standard things that we always do, updates regarding the data dashboard, coverage changes, and then a couple of new things with regards to an advocacy group that we're going to be doing. And then, as I mentioned, Mark Cohen will be talking about a PO scorecard. So first things first, the collaborative-wide meeting is coming up on June 16th at the Lansing Community College West campus. Registration is open until until June 2nd. And the attendance is required for PO administrative leads and clinical champions. Practice attendance is optional. If you would like for your practice clinical champions to attend, they are welcome to, but they are not required to. That is also going to be split between MCTTD and Inhale. MCTTD will have the morning session from 8 to noon with a one hour lunch from 12 to 1, and Inhale will be in the afternoon. This is our tentative agenda for the MCTTD portion. So we will be starting it off with Dr. Oshman, the program director, with a welcome and review of some preliminary quality improvement data. We'll have a talk by the M-Shield team, which is another CQI focusing on health equity. If you're not familiar, their talk will focus on health equity and social determinants of health. Then we'll be having a further discussion with regards to health equity as it pertains to MCTTD, led by Dr. Oshman. We will then be hosting a CGM panel and discussion. Many of you are probably familiar with this, as we reached out to obtain panelists for this. And then we're still in the process of nailing down a keynote speaker, which will be our final talk of the morning from 11 to noon. All right, so regarding this new item, annual PO check-in calls, so beginning in July of this year, instead of doing QI logs like we had you guys do last year, we're going to be conducting annual calls with you guys, so just once a year for each PO. We really want to focus these calls on discussing your participation in the program, how it's been going, what do you need from us, and really an opportunity to address any specific questions that you as the PO have, any areas of uncertainty that we can clear up for you guys. We will be sending out a link for Calendly sign up the week of the 22nd. And sign up for the sessions that we're going to be offering, the time slots. It will be first come and first serve. There'll be 3 dates available each month. And so we just ask the administrative lead from each PO attend at minimum. Other PO contacts, such as the clinical champion and anybody else that you'd like to have there, are welcome to attend as well. I will note that if you guys do have a data lead at your PO level and you'd like for them to attend, that would be a worthwhile addition as well. So a brief recap of our regional meetings up until this point. I'm actually presenting from a hotel in Bay City. We have that meeting this evening. And so we have done 5 so far with 2 more to go, including today's. And so as you can see here, these are the ones that we've completed with the regions and the specific areas. And then we take, as we always mention, the feedback from these meetings very, very seriously. And so you can see here the average scores. For the most part, we do improve each cycle with our scores because we do take that feedback from you guys very seriously. And this is real quick the posters that we have had at each of these meetings and continue to have available. So these posters were designed by members within your practices, within your POs, and we tried to make sure that we had at least 1 representative poster submitted from each region. And then our wonderful design team took the rough drafts submitted by you guys and made them into these gorgeous designed works of art that we then make back available to you guys. And so these are available to all of your practices and clinical champions at each of their regional meetings. All right. So a couple of the things here we did at the regional meeting. So we have done Coverage Quest. I'm sure some of you have probably heard some feedback about it from your practices. So this is something a little bit different than you're probably used to. So we designed a Dungeons and Dragons adjacent type game to make quality improvement mapping a little bit more fun than it typically is. And so we joke that if you like games, this is a game. If you don't like games, this is just QI mapping. And so this is some of the feedback that we've received about it. I think a lot of people have, when they first see the game boards get broken out and the music start playing, they're a little skeptical. But most people have reported that they found it to be both worthwhile and a fun, creative take on quality improvement. So I won't bore you by reading these quotes, but these are some of the feedback that we've received. So we also elicit future meeting topics at all of these meetings, and this helps guide the themes and topics for the next round. As you guys know, we host these twice a year in the spring and fall, and so all of the feedback that we receive from this round of spring regional meetings we'll be using to plan our agenda for fall. And so some of these are these are some of the items that we've received. So talking more about the workflows on getting CGMs covered and the management of that continues to be an area of uncertainty for many practices. Understanding the Medicare Part D, how it works regarding copays, costs, and deductibles. And as we'll talk about in a little bit more, there has been changes to that even just last month. We're also be talking more about advocacy and how to input patient voices into what we're doing more so. Talking more about high cholesterol and diabetes, getting more into the cardiovascular outcomes and talking about ketogenic diets with diabetes, because we know that there's that distinction between what we call low carbohydrate diets and what is on the market as ketogenic diets. And then just as always needed, more updates on coverage. And so one of the meetings that we do have coming up is our steering committee. So we have convened the MCTQD steering committee. We've had one inaugural meeting so far. Excuse me, I can't speak today. And so we will be having these on an ongoing basis in September 2023 through August 2024. We'll be really eliciting a lot of their help with regards to PCP VBR. And then we'll have fall regional meeting planning, their input from them on that, and then updates to the data progress with regards to our work with MDC and the PPQC all payer data. We are also hosting our next patient advisory board meeting this coming Tuesday, so next week, Tuesday. We have an agenda set for this, and we'll be talking through some of our new patient-facing tools, starting an SGLT2 and starting a GLP medication forms that are really meant to be given to patients in clinic when they're first prescribed those classes of medications. We'll be eliciting feedback from patients on those. We're going to be actually designing a patient advisory board logo, very similar to how our design team has created individual logos for each one of the regions. We'll be discussing and talking through some of the Medicare and Medicaid changes to CGM coverage. And then we'll be introducing the policy advocacy group to them, as well as we'll be introducing to you guys here and trying to integrate some patient voices and patient interaction into that as well. And then, as always, we'll have their feedback as to what topics they would like to be involved in future meetings. All right, so this best practices database, and so you guys have submitted your best practices to that survey that we had sent out before, and so we'll be launching the database, which is really the fruit of that labor, on by Wednesday, May 8th. So that is, I believe, should be June 8th. We'll be sending an example out with the newsletters as how to use that database. So, for example, this will allow practices to search for other practices that have submitted cases that are similar to their practice demographics. For example, if you have a practice that has a care manager and an embedded pharmacist and a dietitian, they could search for ones that have similar. They could search by practice size or practice locations, such as urban or suburban or rural. They could also search by the percentages of patients that are on different classes, different types of insurance, or are English speaking or non-English speaking. So this is going to be a resource available to you as at the PO and your practices in order to find examples of practices that may have had success doing something you're looking to do, so that you don't have to necessarily start from the drawing board. And this is an example of what this will look like. If you want to search here for sites who have attended, who have advanced practice providers, for example, and are employed by a hospital-based system, you can also put in free text. And so you can see that result here on the bottom. Has advanced practice providers? Yes. Practice configuration, employed, hospital-based. And then text, meaning that would be like the terminology that you could search using our free text box, is CGM there. And then you can see that it says your search came up with 13 best practices. And then you can click on each of these records to view the response to them. So this is what that looks like. And so after you review them, they will turn orange. And then a subset of these have actually responded that they're okay with being contacted by some practices in order to get further information and have that discussion and open that dialogue. And so those will actually have a button here that says contact practices. And so those are the practices that have responded that they're willing and open to having other folks contact them to discuss a little bit further. So the way that that'll work is you'll click the contact practice, and that'll send the MCTTD Coordinating Center an email saying that you're interested in contacting this practice. And then we'll provide you with that practice's contact information for you to be able to reach out to them. All right, so for our June data updates to the dashboard, a couple of items here. The biggest one is that we'll be integrating the Blue Care Network claims. And so as you're likely aware, right now we have the Blue Cross Blue Shield PPO claims and only dual attributed Blue Care Network patients, so patients that have PPO and BCM, which is a very small subset. But by June, we will have patients, a full integration of patients with Blue Care Network. So that'll expand the data source of the dashboard considerably. We'll also be updating our A1C summary statistics. As you can see here on the right, this is what it looks like currently. That buckets where we have less than 5.7 all the way up to greater than 9.0 will be changing to these different categories here to make it a lot more operational and more specific to what is actually relevant to patients with type 2 diabetes. And so we'll now be switching this down to having less than or equal to 6.5 with more sub buckets in the middle there, and then greater than 9. And then some advances in coverage for CGM. So as of April 16th, patients with type 2 do no longer need to have that 3 times a day insulin requirement. They only need to be at least on insulin once a day. So it is insulin treated now is the definition, instead of defining the exact amount of insulin per day. And so a couple of things to note here is that the coverage is even further for patients that have problematic hypoglycemia. And so Medicare is currently defining problematic hypoglycemia as having at least 2 hypoglycemic events with a glucose less than 54, with at least 2 previous medication adjustments or modifications, or at least 3 hypoglycemic events with a value less than 54 associated with altered mental status and or physical state. And then just one final note on this is that in order to get CGMs covered, clinicians must also document that the beneficiary has received appropriate training for the device and that the CGM is prescribed in accordance with FDA indications for use. So we are working on the smart phrase library, and these will be items that will be included in there so that you guys can take that and use those smart phrases to help with this documentation if you don't already have a process in place for that. All right, so the coverage changes to Medicaid. So the new guidelines or the new coverage was issued on May 1st and will take effect on June 1st. This does affect Medicaid, Children's Special Healthcare Services, and Healthy Plan Michigan, as well as the maternity outpatient medical services. So previously there was not a well-defined Medicaid coverage for CGMs. This is now a actual coverage criteria laid out by them. And so this is primarily saying that persons that have the beneficiary is under the care of either an endocrinologist or a physician or APP, and the beneficiary has diabetes requiring administration of insulin or is currently using an insulin pump. And so this would also not define how many injections of insulin per day. And saying that the beneficiary also is educated on the use of the device, similar to how Medicare is. There is prior authorization required for patients with type 2 diabetes that are not insulin using. And so this includes all of the conditions as well in clinical scenarios where CGMs may be beneficial, but it does not specifically only include type 2 diabetes. All right, so for our policy advocacy group, we're going to be having this new group established this year. So what we're hoping to do with this is to establish a group of patients, providers across the collaborative, and any other interested parties, including administrative leads, to really start conceptualizing how we can leverage the power of the collaborative to work together to make positive change at a systemic level. And so we have over 1,000 members representing 28 POs and 338 practices, and it's time that we start to really leverage that and start to use those unique perspectives to advance the cause of diabetes care in the state of Michigan. And so some examples of the type of work that we'll be doing will be to continue to submit comments on things like that Medicaid CGM policy revision and working on other position statements that we could submit to other payers and increasing coverage and reducing cost to patients for things like SGLT2 inhibitors and GLP receptor agonists. And so if you are interested in participating or being involved in any way in this type of work, please email Noah Kim. Their email address is at the bottom of the slide if you are interested in being involved, or if you have specific ways that you think that we should take this. All right, some basic reminders here. Our learning community events that we'll be offering for the rest of the year are listed on our website. The most pressing ones coming up here are the Monday, May 22nd, Cardiology and MCTTD by Dr. Devraj Sakal. And then on the 9th of June, we'll be having a panel discussion regarding the implementation of MCTTD initiatives with these wonderful participants listed here on the right. And so these are the most pressing upcoming sessions. The rest of the sessions are listed on our website through the end of the year. As a reminder, these learning community events do meet your learning community VBR requirement for your attendance if you come live. And then if you're not able to attend live, you can view a recording and answer a brief set of questions regarding the recording to get credit that way. You do not need to answer the questions if you attend live. We do mark your attendance down. And then these are our upcoming VBR requirements that are all due on June 1st. And so the practice level learning community requirement, as well as the physician level learning community requirement and the case summaries for cohort 2. And so we will be sending out reminders to the PO leads on all of the dates listed on this slide for each of these 3 levels of VBR requirements. And so any sites that have missed local regional meetings will need to view the recording of that regional meeting that they missed. So if you're in the Kalamazoo region, you'll need to review the recording of the Kalamazoo regional meeting recording, which these are not quite available yet, but they will be. And then as a reminder, not attending in person will count towards one of the 3 strikes for regional meeting attendance requirement. The practice, you have to do that in order to be able to maintain your status in MCTTD participation. And then clinical champions, along with PO leads who have missed regional meetings, you'll be contacted by 5/18 of this month with the latest link to the recording. Like I mentioned, is not available as of now, but will be by the 18th, and that will need to be completed by the 6/1 deadline. All right, so our July PO work group meetings will be on July 10th at 11 a.m. and then on Wednesday, July 12th at 2 p.m. As always, we have these 2 offerings. And with that, I'm going to stop sharing and turn this over to Mark Cohen. Mark, are you on the line?
Yeah. Hi. How's everybody doing? So I'm going to give an update to a couple things. One, just want to kind of go over an announcement that went out this morning, and then to go over the PO scorecard incentive model that we're planning. So let me share my screen. Okay. So if you hadn't, if you weren't aware of this yet, a PO announcement went out, both on the PO collaboration site, the main announcement page, as well as the CQI, the subpage that's related to the CQIs. Effective this July, we are putting forward a multi-CQI PO reward bonus for POs that are participating in multiple CQIs. And it's for those POs that started on or before September 2022. This is going to be the first year of an ongoing bonus reward throughout the that we're going to be rewarding annually. It's for the population health CQIs only. This first year we are putting it out. There are some stipulations in terms of you have to be an engaged participant. So you as a PO, should be meeting the participation expectations of the CQIs. So we asked the CQIs to come up with the general categories, given that this was something we were kind of adding late in the game because we wanted to kind of put forth this bonus. But our leadership at Blue Cross really want to make sure that we're giving this out to those that are engaged in part and really show that they're participating in more than one. So the CQI came up with the CQIs got together, came up with a set of participation expectations that are pretty universal across all of their programs. And then each of the POs that are in multiple CQIs, of which many that are on this call are, each individual coordinating center evaluated them, and they're going to be providing that information to us in the next few weeks to show who won. Who earned the reward and who didn't. Basically, who met the participation expectations. The multi-CQI bonus will be distributed in two parts, similar to the what we do with the current PO reward model, where we have a flat bonus, where we have a flat payment and a variable payment. So the structure will be like this, and some of you may have seen this. If I have a PO focus group, and some of you may have seen this. So this may not be new, but for most of you, this is fairly new. So if there are participation in two CQIs, the flat reward bonus is $25,000. 3, it's $50,000. 4, it's $75,000. And then for the variable bonus reward, if you're participating in two CQIs and you meet the participation expectations, you're going to get a $10 bump up per patient across the total eligible member or patient count, $20 or $30 if it's 4 CQIs. So that's based on, similar to how we're rewarding on the variable payment right now. We're going to be doing specific data pulls for MCT2D and Inhale. MyBack, it's going to be the number of eligible appropriate patients that are captured in the registry. And currently right now we don't have any volume count for MyMind that's applicable. So it'll be based on at least those 3 patient or member counts. As I said before, this is rewarded on an annual basis. And criteria are going to change and are expected to change annually, which I'm going to jump into in a minute. But we'll be providing another overview of this change on the May 24th collaboration call. So anybody that isn't either attending this meeting or other PO meetings, we're going to have a chance to provide some more detail on this. And so this structure is for this PGIP payment cycle. So it will be for, depending on how you score, if you PO, you met participation expectation for all of the CQIs that you're participating in, you will receive a disbursement of this reward in July. and a disbursement of the reward in January. The flat in July and the variable in January. So do I have any questions on that? Okay. I can't see the chat. Is there any questions in the chat?
Nope, no questions in the chat, Mark. Oh, actually, just one just came in from Emily. She was asking if POs are able to get a copy of what you were just showing, that document.
This was posted on I made an announcement this morning on the PO collaboration site. So if you get alerts to our CQI page on that site, it's there. And so it's a little easier to find because we don't have as many things there. But right now, it was posted this morning on the PO collaboration site. So if you go there and you look for an announcement, you should be able to find it there.
Are you able to put a link to that in the chat, Mark, by chance? For the
let me see. I think so. Hold on. I can do that right now. It's still the first thing up there, so nobody else has posted anything else today. So it's still the first thing there. Here, let me add this to chat. As long as you know, most of you, or not all of you, are are tied to a PO somehow, you should have access to the collaboration site. If you don't, you can shoot me an email, and I don't know how to get you access. Or actually, I would reach out to your PO leadership, and they can get you access. So that is something that is happening very soon. We were very happy that we could pull this out for this current reward period, and we didn't have to wait at all. But what I'm going to show you now is what we're going to be doing for the future reward period. So let me share another document. See, I'm going to do the present in Teams. Oh no, I'm not in Teams. Oops. Sorry. I'm so used to doing Teams that I realized I shouldn't have pushed that button. Okay, let me back out of that. Okay. Nope, wrong page. Hold on. We'll get it. We will get it. Okay, are you guys seeing a PowerPoint slide?
We are, yes.
All right. All right. Are you seeing it in the presentation format?
No, just in normal PowerPoint.
Damn it. Why does it do that? Hold on.
We were able to see the slides just fine, though, Mark, if you want to go in that way.
All right. Let me go back. Okay. All right. So I gave this on May 8th, sorry. So this is a rerun of that. So as many of you know, currently the way that we reward for the PO reward for participation in the CQIs is through meeting a set of general expectations. It's it's defined, but it's more loosely defined, and we don't have, there's really isn't there are many different criteria, and we don't have anything that says, if you can compete, do 3 of 5 or 4 or 5. We don't have it really a defined way of understanding if you're really engaged in meeting all the expectations of the CQIs. So we are kind of evolving the program, and this is what we were going to do anyways. And so this isn't anything new. But that's why I'm making everybody aware. We are going to be implementing that pay for performance model for participation in the CQI. So, and really this is to encourage and reward accountability for your PO's participation and engagement in the CQI. And keep in mind, this is all tied to the PO reward, not tied to the physician VBR. This is for the PO. So the new model that we're going to have, so where the CQIs have given you a set of criteria, expectations that they expect you to meet, and For the most part, they're evaluating you on that, and for the most part, if you're doing most of that, you're participating and you're engaged. We are going to be utilizing this new model, new for the population health CQIs, but we've been doing it for the hospital CQIs for quite some time now. And that is, we're going to have a CQI performance index scorecard. So each CQI, so MCT2D or Inhale or MyBack or MyMind will have their own scorecard. And each scorecard is going to have a maximum of 100 points. And the reward that a PO can earn, the amount that they can earn, will be proportional to how they score on that scorecard. And I'll go through an example. But we're going to apply this to all of the population health CQI rewards. So the flat reward, the variable reward, the bonus rewards are all going to have this performance index component. So here's an example. Now on the right, you see a scorecard. This is an example of the hospital medicine safety CQI scorecard. This was for brand new sites that were participating in 2022. And the reason why I'm showing you this is because these are their participation measures. This is how they measured participation. So around timeliness of data, completeness and accuracy, and meeting participation of various members. So that's something. So as we're starting this out, the scorecards are going to be heavily weighted on participation-based measures, not performance yet, because we don't have that data to start measuring you on and reporting back. So that will change as we evolve. But for right now, it's going to be participation-based. So let's take a PO that participates in a CQI, a population health CQI that is. On their scorecard, they get a 75, and the maximum potential score is 100. That's like they scored 75%. So if their maximum potential for earning in that CQI between the bonus reward and the flat reward and the variable reward, let's say it's $300,000. If they scored 75, their earnable amount, what they're actually going to earn is 75% of that. So in this case, it would be like $225,000. So they would be like leaving $75,000 on the table if they're not achieving optimal participation. So I'm gonna skip that for a second. So I want to go through this too. So as the program matures, as I said before, the rewards are going to shift. So right now, when we're talking about performance, it's really how you perform from a participation and engagement standpoint. As we start getting measures, as we start developing different types of measures related to quality improvement, whether it's structure, process, or outcome, the scorecards will shift more to performance-based. A participation component is always going to remain. We know, and this happens with the hospital CQIs, because we realize, we need you to attend the meetings, or it's part of collaborating on these CQIs is attending meetings and sharing and learning best practices. So that participation engagement component will always remain. And our current goal, our future current goal, is we would like to eventually hit a weighting of 50% participation and 50% QI-based performance within about 3 to 4 years. So that we'd be looking for MCT2D, for instance, we'd be looking at like a measurement period in 2026 and like something reward in the 2027 period. That's just an example. But eventually you're going to see this evolution from participation-based performance to really quality improvement-based performance. I'm going to slide back to this timeline so you can kind of get a feel for how we're going to set this. So these are 4 rewards that are going to start January 25. So they're going to start with the variable payment and then pay out in July 25 too. So one score is going to impact 2 payments. So but I will caveat that if you score really well, and then all of a sudden you decide to really start flaking off, that may not have an effect on that second payment, but the following year, when the next payment comes down, it could heavily impact that payment. So, just keep that in mind. It's a score for that will impact the year, but if you don't score in that year, that in the current year, so if like in 2025, while you're earning this payment, if you're not doing well, it will affect your January 2026 and July 2026 payment. So the measures are currently in the process of being developed and shared with clinical champion leadership, with the coordinate at the CQIs. This information is going to be submitted to us in about 3 to 4 weeks. And we're going to have probably about a 4 to 6 week period where we're going to be evaluating these scorecards and making sure that they're approved by our clinical leadership. Then there's going to be a measurement period. And I'm giving this as an example because I think at this time, if we get everything approved on time, it's probably going to be about September 23 to August 24, let's say. Now, in between that time, and I don't have that on here, I apologize, I meant to add that, but there's going to be a point mid-year where you're going to get, a report back to show you how you're scoring. Unless the CQI is going to do something real time, you're going to get mid-year, you're going to get a score back that says, here's how we're doing, because we don't want to surprise you at the end of the year with a score that you may not, if you may have thought you were doing 100%, you're actually doing 60%. And we don't want you to be kind of surprised by that. And then also, if you as a PO isn't meeting those expectations, it also gives you an opportunity to really start to improve and identify where your performance issues may be. In October 24, after the measurement period's over, we're going to get those scores submitted by each coordinating center. And then there's going to be a scoring evaluation by us. So we're going to do that pretty much in November, and then we start the PCP reward processing. And then the reward will be released in January, as I said, in July. So during when they hit your cost centers. So that is a general timeline of the first iteration of this PO P4P population health CQI rewards. So with that, I will take questions.
Great, thanks, Mark. Does anybody have questions for Mark before we turn it over to the Inhale team?
If that was crystal clear, that was great. Otherwise, I will be also repeating this, may add a little more detail at the May 24th collaboration call as well. So we're gonna go over this again and follow that up with the PO announcement that will put this in more detail as well. And then eventually you'll be getting once we have the approved scorecards, you'll be getting that as well from your respective CQIs.
All right, great. Thanks so much, Mark.
Thank
Carla
you.
and Courtney, I will turn it over to you guys. I'm not sure what your plan is for the remainder of the 20 minutes, but if you are only an MCT2D participant, feel free to drop off.
Yeah, I'm going to give people just a couple seconds to drop off, but I think we can slide through our slides pretty quickly. We'll also be sending out an email with an overview of everything, just in case we don't get through everything. But let me share my screen. Hi to everybody. Also, thank you for staying on, and I'll go through this pretty quickly. Let me see if my slides are actually going to go here. Oh, come on. Oh, there we go. Expecting too much. So our normal agenda, announcements and updates, measured data hub, portals, PO practice recruitment, upcoming events, and questions and discussions. Really no announcements other than they'll come a little bit later, but just in general without dates or anything. Just a reminder of everybody to make sure that you have that contact at inhalecqi.org email address to your safe senders list so that Inhale communications don't get lost in spam or junk folders. We talked about this at last meeting too, but we know that it is happening because people have asked us to resend things. So make sure you check that spam folder and junk folder because we know that as things are sent out as a big group that they may get lost in that. So we do want to acknowledge that Michigan Data Collaborative, MDC, sent a message regarding the discovery that they had missed providers and patients within our latest Inhale dashboard release. Our data analyst was able to catch this really quickly, and MDC was able to work through a processing error and have had everything's been rectified with that, and the missing providers were updated. So we've all clear with that. We have a fantastic data analyst to make sure that everything that you're seeing is accurate. Portals and websites, hopefully you've already checked it out, but our Inhale website is live, inhalecqi.org. We're going to continue growing that and with more and more information and resources. We would love your feedback on that. Look at the resources. Do you like the way they're put together? Are there too many, too little? Can you search them in the way that you want to? Are you finding the things you want to? Do you want other things? And then also, do you have things you want to share with us too? And we can look at them and see if they would fit well with what we're doing too. So we would love for you to check that out and give us our feedback. You can give that feedback either to the contact at inhalecqi.org or to me at Carla@inhalecqi.org. Again, we'd love that feedback. Administration portal, no updates this time. Just make sure that you're uploading your newly recruited PCP practices, their participation agreements, and remember that needs to go on the admin portal. Let us know if you have any problems with that. Again, at either one of those emails. Also, I think Courtney, Nod, yes, I think you've uploaded everybody's providers onto our new Inhale Learning platform, which is part of that inhalecqi.org website. If you have any questions about using that, again, let us know. There is a CME linked medication deposition learning opportunity there right now. I would hold off and watching that right at the moment because that might be linked to participation, but they can definitely watch it if they want to, but there will be linked to participation for next year. Talking about practice recruitment and PA recruitment, our next recruitment period for the PCPs and pediatricians opened April 1st, which you guys knew about, and we need those agreements to Inhale by June 1st. That VBR for that new group of practices will start September 1st, 2023. We do have a lot of information on our members page on that Inhale website we're talking about. We're really going to sell that heavily today, inhalecqi.org. There's a lot of resources. Courtney spent a ton of time uploading all of that information and creating that website. Again, another reminder, make sure you upload those participation agreements. And here's our upcoming events and important dates. Our PO Clinical Champions meeting is May 25th at 11 or 3:30. Let us know if you didn't receive information about that or the invite. I know that, again, that some of them has been probably lost in some people's spam and junk folders, but let us know and we can send that out again. Our regional meeting dates, we have those set now and the locations. So you can see those listed here. It's at the end of September, the beginning of October. We have tried to spread them out across Michigan, and we will be sending invites out those coming up pretty soon. Our next monthly call dates, we will not be having any June meeting due to the collaborative wide meeting. And remembering that the collaborative wide, we're sharing that with MCT2D on June 16th at the Lansing Community College West. And that registration should have already been received by you, and hopefully you're getting that back to us as soon as possible. We have questions and discussions. Hopefully I'm not talking too fast, but fast enough to get us in by time here. We have our resource box update. I know a few of you have asked questions. You can see here the things that we'll have in this box. Right now we're getting all of those things together, and Kelly has got full garage and full office space. to have these things. And this is estimated right in here, like the numbers included, the things that we'll have in our box for you. So there's these respiratory treatment folders, posters, which show all the inhalers, both for asthma and COPD. We're going to have the Spanish versions of those on by request only, because I know some areas don't have a strong or high Spanish speaking population, but we'll have those available if needed, or if you feel like you want them. We have the respiratory treatment pads, which I think is also a smaller version of the inhaler poster. There's a lot of tobacco cessation materials from HBOM, the COPD, COPD assessment test tear-off pad, asthma control test tear-off pad. We're actually going to get you some spacers, actually valved holding chambers. They're going to be 10 per box as they're available. And then we also have some demo devices, reminding people that unfortunately, lots of the companies, pharmaceutical companies, are no longer making those demo devices. So we're trying to gather up as much as we can and get those to you directly to you until you can get them out to your practices. And we're going to be creating a how to use your box and help give you some guidance on, or help your practices give some guidance on how to use those. Sorry, I know I'm talking really fast, but I just want to be really respectful of everybody's time. So yeah, that's it for us. So quick and down and dirty. I don't know if anybody has any questions, concerns, thoughts. Everybody's still awake. Nobody's on camera, but.
Hi, this is Amy Reca. I'm just wondering if there's any update on when specialist data would be available.
Fingers crossed, June release. It has all been approved by us and Blue Cross Blue Shield. Now it's up to it's MDC. They're implementing it. They've had to change their process a wee bit, and so they have to have that process changed. Even though what we want to do has been approved by Blue Cross Blue Shield, MDC also has to get that approval directly from Blue Cross Blue Shield in order to implement it. So we are pushing as gently hard as we can to get that done. So yes, we feel that it's all set to go. Blue Cross Blue Shield feels it's all set to go. So we just need MDC to implement it now.
Okay, thank you for the update.
Yeah. Anything else? Super fast. We're looking forward to seeing everybody at the Collaborative Wide. It's great to meet in person. And we're really looking forward to the regional meetings. If you have any input on what you think your providers in particular would want to learn about, we have sort of a idea on our own about what we want to do for regional meetings, but if you have any special requests, please let us know. Gina, I'm seeing your hand raised.
Yeah, just a question about the regional meeting in the fall. Usually it's the practice champions that are involved in those.
Yes,
with the diabetes initiative, they have limited it to one person per practice. Will that be the case for Inhale?
We were planning on two to up to 3 people per practice. So we were thinking that we were the practice clinical liaison, obviously, and then the practice liaison were the people that we were thinking of. And then if there was a really interested physician that wanted to come also, I think we're okay to have that up to that number at this point in time. It's gonna get tighter, you know, as spaces, as we get more practices involved, and you know, to get space and make sure that we have enough opportunity to talk to everybody. So, but at this moment, I think we're okay with that. Does that sound right, Courtney? Okay, Courtney says yes. Any other questions? And just what saying that about the regional meetings. Sorry, let me get back over here. Of course, I'm not sharing with you anymore either. So let me share again. We're thinking that the regional meeting in Rochester Hills, the way we did it is we looked at the maps of where their practices are laid out. So if you have a PO that has practices all the way across the state, obviously not everybody's going to go to the same one. I'm sure it's the same with the MCT2D. The Rochester Hills section is quite dense. So I think that the providers that are in that area are going to be the ones that unless they choose to go to a different meeting, we're not going to have other people coming into that meeting because that meeting's going to be quite big potentially. So all the other ones, I think there can be some little sliding kind of work if like you have somebody that's close to Ann Arbor, but is really in the, I don't know, Rochester Hills area in that section. They could come over to Ann Arbor, but we're not going to have anybody else go back over to Rochester Hills. At least that's our thinking right at the moment, just because we have have a bigger chunk of practices in that area because it's the density of providers is much higher. So, but we'll get those invites out pretty soon. Kelly, do you have a time frame on that one?
I'm hoping by the end of the month.
Great. Any other questions? Not seeing any. I'm hope I didn't like blow through that way too fast. Luckily we didn't have a lot of things. We didn't know initially that Mark was going to be participating also or giving more information. So I appreciate that MCT2D was able to keep their time down and Mark was able to get through things quickly too. So not a lot of updates, but some really, really great information out on that website. And again, we'd love to have your feedback on anything and everything that's there. So if there's stuff that you want more information on, stuff that you see there, but that doesn't make sense, or stuff that's out there that you know is out there, but you'd love to see on this website, we want to make it to be a really powerful resource for you. Anything else? I'm going to check the, nope, I'm not seeing any other questions. So if that's the case, thank you very much. And we will see you in June, which is next month, which is crazy. We'll see you in June for the collaborative wide. And again, any point in time, just feel free to reach out at that Carla at inhalecqi.org or at contact inhalecqi.org. So thank you very much.